The most valuable thing that an AI can do in a healthcare organization is collapse time. Think about that for a second. We hear a lot of noise about artificial intelligence replacing doctors or completely taking over clinics. But according to the insiders who are actively building these systems, AI's real superpower in medicine right now isn't about replacing humans at all. It's simply taking time, something that's in dangerously short supply, and giving it back to the people who actually save lives.
Hey everyone, welcome to today's Explainer. I am so thrilled you're here. We've got some incredibly fascinating source material to unpack today covering the AI healthcare revolution. We're going to cut right through the hype and look at exactly how new technologies are actively rewiring the medical field, from the dry back office billing departments all the way down to the actual living biological data inside your body.
Okay, let's dive right into this. Look at this number, 500,000. The source material from Stack AI highlights a major healthcare provider that literally saved 500,000 hours of manual labor just by deploying what are called AI agents. I mean, 500,000 hours. That is a staggering amount of human capital suddenly freed up from mindless, repetitive tasks. So here is our roadmap for today. We're going to cover the healthcare admin crisis, agents as time compressors, the battle of the bots, building the digital twin, hallucinations and hurdles, and finally, the future of health span. Starting off with Section 1, the healthcare admin crisis, or the physician's burden. Now, to understand the cure, we first have to fully understand the disease, right? So let's establish a quick baseline. Our sources feature Dr. Aaron Segal, who brilliantly explains that large language models, or LLMs, are basically deep learning systems trained by digesting massive amounts of public data. Their core function? Just predicting the next word in a sequence. But that simple function gives them an incredible ability to summarize and generate text, which, as it turns out, is exactly what drowning physicians need right now.
And why is this technology so desperately needed? Well, the burden on doctors right now is just staggering. The sources reveal that doctors are spending 15 to 30 minutes just writing notes for a single patient. Imagine a 90-minute process where the doctor is only actually getting reimbursed for 45 minutes of it. The rest? Purely administrative overhead. This leads to hours of unpaid documentation completely spilling over into their weekends. It's driving escalating burnout and a severe shortage of skilled labor. The system is just fundamentally broken.
Which brings us to Section 2, agents as time compressors and automating workflows.
Now, there is a really important distinction we need to make here. An AI agent isn't just a standard chatbot like ChatGPT, where you type a prompt and it passively gives you an answer. An agent is instructed to autonomously execute specific, multi-step tasks. It actually has a job to do. It's a workflow compressor. You don't just ask it a question. You tell it to go schedule a patient, verify their insurance, and update their file, and it just does it.
Stack AI's data reveals a fascinating breakdown of this. By deploying agents to handle patient support, they process 20,000 requests a week, pulling history and giving HIPAA-compliant answers instantly. For call compliance, like auditing and summarizing calls, an agent runs 50,000 times a week. And physician assistant agents can actually retrieve labs on demand. Delegating these basic repetitive tasks scales a clinic's efficiency practically overnight.
Moving right along to Section 3, the battle of the bots and revenue cycle management.
To really grasp the scale of the back office side of things, look at this number from an AWS presentation in our sources. The revenue cycle management market is currently sized at $174 billion, and it is expected to explode to $450 billion in just the next 6 years. This is the massive, highly complex pipeline of actually getting a hospital paid, and it is entirely ripe for AI disruption. So the crucial point here is that one single AI can't do all of this. It requires what's called a multi-agent claim process. Think of a central orchestrator agent acting like an air traffic controller. It routes a patient's file through highly specialized agents. One handles eligibility and prior authorization, another one analyzes the doctor's clinical coding, a third scrubs the claim to ensure it meets strict insurance standards, and a fourth specifically manages denials. It's essentially a symphony of specialized bots all working together. And this brilliantly illustrates what insiders actually call the battle of the bots. On one side, you've got the payer, the insurance company, using AI to automatically scan and reject claims faster than ever to save money. On the other side, you have the provider, the hospital, using their own AI to automatically analyze those rejections and instantly generate appeals to secure their revenue. It is literally machines fighting machines over insurance denials at lightning speed.
All right, Section 4, building the digital twin for personalized medicine.
Okay, shifting gears from the back office to the actual human body. Dr. Segal's team launched this incredible project called the 10K Initiative, measuring participants across Israel, Japan, and soon Abu Dhabi. But it's the sheer depth of the data that's mind-blowing here. They aren't just looking at shallow hospital visits. We're talking full genome sequencing, microbiome data, tracking blood sugar with continuous glucose monitors, wearable fitness data, deep physiological imaging, the whole shebang. All told, they are gathering up to 13 million data points per person.
So why on earth collect 13 million data points on one person? To build a digital twin. It's a high-resolution, completely virtual simulation of your unique biological makeup. So instead of the cookie-cutter, one-size-fits-all medicine of the past, AI can use this digital twin to actually predict your future diseases or safely simulate how a specific intervention, like a new diet or a new medication, will affect you before you ever even take it in the real world. Absolutely wild.
But let's bring it back to Earth for Section 5, hallucinations and hurdles.
Because as exciting as this all is, we have to ask a vital question. Is it safe? And can we actually trust the AI right now? One of our sources discussed a recent study out of Cedars-Sinai that tested AI note-taking software. And guess what? They found that the AI still contained significant errors and actually mixed up patient contexts, bringing in information from previous patients into the entirely wrong notes. Now, this happens because of a phenomenon called an AI hallucination. This is when an AI confidently presents a completely false statement or even invents a fake medical reference and states it as absolute truth. Because these systems are fundamentally designed to just predict the next word, they sometimes predict words that sound highly plausible but are factually wrong. And this is exactly why a human in the loop, a real doctor reviewing the output, remains absolutely critical. And beyond those hallucinations, we face massive data roadblocks. Unlike the open internet data that trained ChatGPT, healthcare data is highly protected and completely siloed. There's no massive open-source medical record database. Furthermore, standard electronic health records are incredibly shallow. They list a diagnosis, sure, but they completely lack the vital behavioral, nutritional, and lifestyle data that actually determine your overall health. Make no mistake, without accurate, deep, and integrated data, the AI revolution in healthcare will simply stall out. Finally, let's look ahead to Section 6, the future of health span and proactive healthcare. Assuming we do actually clear those data hurdles, what is the ultimate goal here? Well, Dr. Segal paints a picture of a sci-fi sounding but actually highly imminent reality, the smart room. Just imagine an AI agent connected directly to your real-time blood biomarkers, your continuous glucose monitor, and your smart fridge. It knows exactly what nutrients your body is lacking that week, and the agent automatically places a grocery order to have those exact preventative foods delivered right to your doorstep. It makes following a healthy lifestyle almost entirely frictionless. And that brings us to the core mission, summarized just beautifully in his quote from the Longevity by Design source: the ability to add years to your life and life to your years. The ultimate goal of AI in healthcare isn't just about faster billing or reducing doctor burnout, though, as we've seen, those are absolutely essential. It's actively shifting from a reactive system that just treats you when you're already sick to a proactive system that actively extends your human health span. So we've covered the crippling admin crisis, the incredible time-saving power of these multi-step agents, the intense battle of the bots over billing, and the deeply personal promise of digital twins. As this technology rapidly evolves from just scheduling your appointments to literally ordering your food and predicting your future diseases, I want to leave you with this provocative thought. When the time comes, will you trust an AI agent to make your health decisions? Thank you so much for joining me today. Keep learning, keep questioning, and I'll see you on the next explainer.